Now, we do see some celebrities in the media, and they seem to magically be back to their pre-baby shape after having kids, but that is clearly the exception. This board-certified plastic surgeon, Dr. Shim Ching, talking about mommy makeover myth. It's very common for me at Asia Pacific Plastic Surgery, my practice in Honolulu, to see patients for a mommy makeover, and they come in with some misconceptions. And I'm gonna try to clear those up for you today. First up is mommy makeovers are all the same. They are totally not the same. Every mom is different. Everybody has different concerns, just like my patients for all their procedures. The procedure is going to be different for different people, and a mommy makeover is even more so. Sometimes we can just do the abdomen, sometimes it's the abdomen and breast, sometimes it's other areas of the body, but there is a lot of variation in what we need to do because all people have different changes in their body after having kids. The number 2 most common myth that I see is, well, I can just exercise and my abdomen will become flat again, everything will go away, I can exercise my chest and then my breasts will be larger and lifted. And unfortunately, those things just aren't true. Now, we do see some celebrities in the media, and they seem to magically be back to their pre-baby shape after having kids, but that is clearly the exception, and it's possible that they had some help with surgery as well. No amount of exercise can really fix the changes in the abdomen and the breast after pregnancy, unfortunately. So that's another myth. Number 3 myth is mommy makeovers are just for moms. These procedures really are for everyone who has any concern with these areas, and it may not be called a mommy makeover, but it could be very similar in what we do. Patients who have lost a lot of weight, for example, can have some of the same changes in their body, in their abdomen, in their breasts after a significant weight loss, and they can get pretty much the same procedures even though they haven't been a mom. Number 4, recovery is really long after mommy makeover. Generally, I'm telling people about 2 weeks off of their normal day-to-day activities or light work after a mommy makeover. It does depend on the patient, however. Some people may need more time, some people may need less time. Just like all of our other surgery, we're doing everything we can to make patients recover faster. And that's really the direction that surgery is going. It used to be that patients would stay in the hospital for days after something like this, but these days we get a patient back home the same day. We're getting them up and walking immediately as much as possible. We're doing things to limit the bruising, the swelling, the pain afterwards, and that cuts down on recovery. So recovery doesn't have to be as long as patients think. 5th myth is that this is only a cosmetic procedure. Mommy makeovers help women in many different ways. Not only is it cosmetic, for example, the breast can get very large and droopy after pregnancy, and by lifting them and possibly making them smaller, we can relieve things like shoulder pain, neck pain, grooving in the bra straps, all physical symptoms that are medical concerns, serious physical concerns. And even though this is a cosmetic procedure, it can help with that. The other thing that I see is that when women have babies, the muscle layer in the abdomen gets stretched out, and the abdominal muscles, the core muscles, aren't as strong because of that. By strengthening the core, by tightening that abdominal muscle layer, we can improve core strength. And I've had a lot of women say that they feel stronger, they're able to perform better at sports, and they have decreased back pain after they do a tummy tuck. So I hope you enjoyed this video. If you like this video, please give us a like, comment down below, subscribe to this channel, and we'll see you next time.